my name is Julia. I am the scientific coordinator of the NeoIPC project. I also work as an infection prevention and control specialist at a university teaching hospital. Newborns, when they have to be admitted to a neonatal intensive care unit, they're our most vulnerable patients, really, that we look after in pediatric hospitals and pediatric practice. They, for lots and lots of reasons, are very susceptible to infections, meaning they can get very sick from infections that older children or adults do not get so very sick from. And they are also cared for in an environment where it's very easy for bacteria that live on all of us to be passed on between the babies. This is not to say that people are necessarily doing anything wrong or that they're working in an unclean way. It's simply the environment is structured in such a fashion that this can happen very easily. So the way you can imagine it is you have small babies who cannot keep their own body temperature. They have to be placed in incubators, so small glass boxes essentially, where the temperature control can be done for them. And they also have immature skin. Their skin is very soft. It's not yet developed very well. And various other organ systems that are important to dealing with infections are also not yet fully developed. And so this together really creates the perfect storm for them to become colonized, meaning to carry bacteria that perhaps they wouldn't usually carry. The reason for this is they are in a hospital environment where we have unusual bacteria, and they lie in these incubators where they come in contact with the bacteria of the hospital environment. But they can also then go on to develop infections from these bacteria. Current infection prevention and control interventions are often quite high level. This means you often have a team that works at the level of the hospital. So, for example, me and my team, we are not responsible just for the neonatal unit. We are responsible really for all the units in the hospital. This means that a lot of the interventions are not really very adapted to a specific context. I mean, we know that a lot of the things that we can do to prevent infections from being transmitted or bacteria being acquired in the hospital environment, but often the recommendations for that are very general. They're not very specific. And because of the particular vulnerabilities of babies, because of the particular environment that they need to be looked after in, it often makes it quite difficult to know how exactly would you take these interventions and translate them into something that's relevant in the neonatal intensive care setting? That's one question. And also, are there other interventions that are actually also very specific to babies that would be important to be part of a bundle of interventions that you implement and could be very effective in preventing transmission of resistant bacteria in the neonatal intensive care setting. So this is really the reason why you want to support projects that look specifically at this area and that have, I guess, at their core, also this mandate to investigate interventions that are really very specific to babies.